Psychoanalysis. I thrown everywhere. I thrown everywhere is a gnome. Lacan is very fond of gnomes. And I have used the gnome here. I thrown everywhere. The gnome has multiple meanings and it packs all those meanings into one phrase, which is both complicating and entertaining. There is an excitement of unraveling a puzzle, a paradox. Bill Durant calls it that dear delight of unveiling a modestly elusive truth. And this package phrase, when unpacked, gives us multiple insights, both for theorizing pathogenesis and also for healing. This discussion also sheds light on the autonomous attachment system and the criticality of attachment portfolio management for healing, therapy, and quality of life. Let's unpack this condensed phrase, I thrown everywhere, and see how in different contexts the phrase takes its meaning. The first meaning of the phrase is macro, social, and colloquial. I thrown everywhere speaks about one being thrown socially everywhere, given the power structure in society, given the insensitivity and injustice in society. Most of us experience this being thrown about everywhere. The second meaning is if you go slightly inwards, it is the I, the subject, thrown everywhere in the psychic movements, in interpretation of the stimulus, in responding to the stimulus, in the subject investing itself in the ego, in the unconscious, in the superconscious, in the superego. The subject is thrown everywhere in the psychic movement. Third meaning, when one equates I with one's desire, not equates with one's desire, but one looks at the relationship of I with I's desire. I is thrown everywhere along with the desires. And I is also thrown about by desires. There is a strange relationship of I to I's desire. Partly I is invested in every desire and therefore gets thrown about along with desire. And desire throws about I in many ways. Fourth, meaning of the package phrase. If I equate I with my ego, not with my ego, but sorry, I invested in my ego is thrown about everywhere. Very conspicuously, we can see this in narcissism in manifestation. I invested in ego thrown about everywhere. If you want to separate narcissism and ego, as I have done on the slide, we go strictly by the Freudian model. Then the fourth one becomes I invested in the ego thrown about everywhere in the psyche, especially in the id, and often thrown about by the superego. So I invested in the ego is being thrown about inside the psyche by the other two structural components. If you go by more of the Ocean model, I gets invested in the self, and the self is into narcissistic movements. And in those narcissistic movements, I gets thrown everywhere, gets associated everywhere. That is where any small injury to the self-esteem is seen as threatening to the I's existence, because the I is so invested in the narcissistic movement of the self. The reverse of this movement, the self-disintegration, when the I is invested in the self and the self is not in the narcissistic gratification movement, but in the disintegration movement. Again, as the disintegration starts, I gets thrown everywhere. And in psychosis, I is just overthrown. Seventh and very important part relates to the unconditional attachment mechanism we have. As a species, we are hardwired to attach, and it's an unconscious process. If we don't find human beings, we get attached to animals, plants. If we don't find any living beings, we get attached even to walls and rooms and houses and to areas. And we find how separation is so difficult from an area or even a hostel room we have lived in for 5 years. So unknown to us, outside of our awareness and control, in an autonomous way, I is invested in the attachment movements which are autonomous and is thrown everywhere because the attachments are thrown everywhere. And the less secure attachments are inside, the more attachment is thrown everywhere outside. This attachment mechanism has these characteristics. First, it is unconditional. It will always be active. If it finds objects worthy, it will attach more. Not worthy, will attach less, but will always attach. There is also one part which is conditional. So we can look at attachment in two ways. The attachment, it happens completely unconscious, which is always on, and attachment which happens partly consciously, where we like or partly like an object and we nurture or allow the attachment to go on. So first, if we look at the attachment mechanism, there is an unconditional attachment which is always on, less or more. Then there is another component of attachment which is unconscious but conditional, because some object reflects what we want to see in that object. Unconscious but conditional. Third component of attachment is the conscious attachment, where we consciously get into relationships and we can even moderate those relationships. Fourth is unconscious attachment, but there is a preference conflict, very intense preference conflict. In the unconscious conditional attachment, the conditions for attachment are being met. Our preferences are being met. There is no preference conflict. But there is another kind of attachment movement, unconscious, where there is a preference conflict. Strong preference and strong reservations about the same object. Very ambivalent unconscious attachment. And then there is one more attachment movement, a conscious attachment movements, where the conflict is unattainability of the object. You cannot give up the desire for the object at the same time the object is unattainable. There is an unattainability conflict. So these are the 5 very important attachment movements, and in every movement, the I is invested in that attachment movement. In fact, these attachments are constituents, inseparable constituents of what we call the I. How does this concept become important for therapy and healing? Because I thrown everywhere is a very human condition. And in case of patients, it's even more difficult, I thrown everywhere. So what happens in healing of I thrown everywhere? How does it proceed? Healing I thrown everywhere in therapy. First, one gets into the analysis of one's human condition and finds I thrown everywhere to be an inseparable part of one's human condition. That takes quite some reflection, largely cognitive, partly affective, but largely cognitive. Requires a lot of honesty. Second is analysis of one's desire, more than articulation. Articulation is, of course, the core of it, but after articulation, the analysis of one's desire. An exhaustive, you can call it an exhaustive articulation, which includes analysis, or you can separate articulation and then analysis. Then, in the light of one's human condition and one's desire, analysis of how I thrown everywhere happens. And there we use all the concepts we saw in the last slide. Then comes the point of collecting the fragments of I thrown everywhere. And this often happens along with collection of transferences onto the therapist. Not necessarily completely, but partly it happens through that. As this movement goes deeper, there is a deeper collection of scatter for self-transformation, because self-transformation or restructuring or transformative insight happens when there is silence and deep collection of oneself and realization in that state. The collection then is used to enhance self-cohesion. And then one moves to attachment portfolio management. This is very important, very, very. Just as we have a stock market portfolio management, we also need an emotional portfolio management, very near to what we call attachment portfolio management, where we have some very deep and strong attachments, some moderate attachments, some mild attachments, and we de-risk our attachment portfolio by investing in many objects, many people, many ideas, many ideologies. If we don't have a diverse enough, balanced enough, healthy enough, multi-flavored attachment portfolio, then we are hanging by a rope to one or two attachments. And that creates high anxiety, repressed anger most of the times, and a very high dependence and difficulty of focusing on anything productive because anxiety keeps us focused on the ropes we are hanging by. Then it goes to desire management of articulation of the after articulation of desire, which desire can be fulfilled, which can be partially fulfilled, which cannot be fulfilled and has to be mourned. And this brings us to reality acceptance, which includes mourning, very difficult part of mourning. Then one goes to catharsis of repressed affect, using catharsis and the cognitive work above to go to restructuring and idea of a good life. An idea of a good life includes many goals, a large goal, and in the anchor of the large goal, many small intermediate goals. And in all of this, we see in step 3, step 4, and step 5, the concept of I thrown everywhere becomes very important in the process of therapy, healing, health enhancement, quality of life. Thank you.